Hi, so if you're watching this video, it's because part of your role here at Mercy Springfield is that you may someday need to sit with a baby who might be experiencing some symptoms of withdrawal related to substances that they were exposed to in utero. So we're going to talk through kind of what that might look like and some of the tips that you might need to take care of these infants. The majority of the time, we really want the mom or another parent or someone within their circle of trust to assist with caring for the newborn, but at times that might not be possible. So if that's the case, they might have you go in and complete all of the cares that we would normally expect a parent to be able to complete while the infant is in the hospital. So I'm going to go through what that might look like and the things that you'd be expected to do, recognizing there will always be a registered nurse that is assigned to the patient and they will be overseeing the care of the baby. So the first thing we're going to go over is just some basic infant care. So many infants that are experiencing symptoms of withdrawal tend to have a really difficult time soothing themselves. They're very fussy and they get startled really easily. They don't sleep very well. And so the good majority of what we're trying to do is keep them very calm and collected. And I'm going to show you kind of what that might need to look like. So I'm first going to start by showing you some swaddling techniques. If you're unfamiliar with swaddling a baby, we really like to utilize a muslin or a lightweight blanket if we have them available to swaddle. That way they breathe a little bit more than our fleece blankets do. Most of our babies that are experiencing withdrawal symptoms will sweat, and so sometimes it's helpful to use breathable blankets because they really enjoy having a tight swaddle. So rule number one with swaddling is that you do not ever want to swaddle a baby with their arms down. So this was kind of more straitjacket-ish. We don't want to do that. So anytime you swaddle a baby, their arms always need to be up towards their face. So you can do this in a couple of ways. You can have the baby kind of give themselves a hug and pull the blankets over like this. If it's a baby that's really struggling with scratching at their face and you're worried about that, the other thing that you can do is kind of take their little arm and tuck it underneath the triangle of your blanket and then bring your blanket over in a swaddle. You want to make sure that you get the swaddle nice and tight. So you'll do one side, and you'll bring the bottom part up, and then you'll tuck in your other side. And so the majority of the time, almost 100% of the time, these babies like boundaries. So they need to stay swaddled and contained. So here's our baby that's nice and swaddled. Okay. If we need to change our baby's diaper, which is absolutely something that you would be able to do and to assist with, sometimes it's really helpful to always make sure that you have a pacifier around. These kiddos really enjoy being able to suck on something. It is one of the few things they can do to soothe themselves. So you can go ahead and make sure that we have a binky available. You can put that in their mouth. And then I like to change diapers with the top half of their body swaddled because it kind of helps them to stay contained while you're doing the diaper change. So in order to accomplish that, you can kind of just pull your blankets up. You can pull your bottom. Oops, I can find it in here. You can pull the bottom part down, kind of keep their arms contained. You can go ahead and change their diaper down here. I'm not actually going to change their diaper, but you get the point, right? And then we would need to re-swaddle more nice and neat once we get that done, but it kind of helps them. Usually whenever you take all of their blankets away and remove their boundaries, they will sometimes get really, really fussy and they don't tolerate diaper changes quite the same. I meant to bring some diaper cream in here to show you, but I failed to do that before we started our video. But you should know that any baby that is on our Eat, Sleep, Console protocol should have at the very least some Criticade that we would use for diaper changes. So babies that are experiencing symptoms of withdrawal are very prone to getting diaper rashes, and so we like to be really proactive with that by applying a prophylactic diaper cream. We start with Criticade, so just know that if that's at the bedside, the expectation is that we're putting that on with every single diaper change, whether they have redness on their bottom or not. Okay, the other thing that you might notice is sometimes babies who are experiencing withdrawal might be a little bit stuffy. For the most part, the stuffiness is related to swelling, and so we do not recommend routine use of a bulb syringe unless you can visibly see something coming out their mouth or out their nose. So we do have this available, but again, most of the stuffiness is from swelling, and it's actually not a great idea to go using a bulb syringe if there's a lot of swelling because it can make it worse. But if you need to use the bulb syringe, you would first press down on this to be able to create the suction. And you always want to suction the baby's mouth before their nose. So if they have stuff coming out their mouth, sometimes babies will spit up and it will come out their nose. Always start with their mouth first, then you would empty it, and then you can go to their nose and you can do one side, empty it out, other side, empty it out. Okay, so that's how we would use that. Rinse it out with warm soapy water and then let it dry. As far as bathing is concerned, you aren't expected to be able to bathe an infant on your own. It is something you could assist with, but the nurse would be available to assist with that as needed. We like to do swaddled bathing, which you could see that technique, but we won't go over that today. Something else that you might be asked to assist with and would be expected for you to be able to assist with is feeding. So I'm going to go over some feeding techniques to kind of show you sometimes these babies can be really disorganized in the way that they feed, and they need some special techniques. So first of all, it's really helpful to recognize their early feeding cues. Sorry, I lost my words there for a second. So early feeding cues in this baby would be kind of they start to awaken a little bit. We want to try to catch them before they're fussy. So if they start to kind of root around, when they're kind of moving their mouth one side to the other, they're starting to kind of chew on their fingers. Those are all signs that we're getting hungry. We're waking up. If the baby is crying because they're hungry, that's considered a sign of late feeding cues. So we really want to try to make sure that we're proactive and that we're feeding them at the first sign of hunger cues. So the first thing that we do oftentimes with babies who have some feeding difficulties is we utilize what's called a sideline position. So if you've ever fed a baby, you're probably used to kind of holding them in your arms like this, and you take your bottle and feed them like this. So this isn't the technique that we would want you to use for this population. We would want you to kind of move the baby away from your body a little bit and put them in what's called a sideline position. If you think about it, it's very similar to the position a baby is if they're breastfeeding. They're kind of laying in a sideline position. And the reason that this is so helpful is it allows the excess milk that may pool in their mouth to go to the side of their cheek instead of down the back of their throat like it would if they were laying in this position. So you can do this a number of different ways. My preference is just to cross my legs and kind of prop the baby up in a sideline position. You could also place a pillow across your lap and kind of lay the baby like this, but the goal is that their whole body is sideline. What you don't want is to have the baby on their back and their face to the side. That's not going to accomplish what we need here. We want the whole baby to be in their sideline position. Then we would take the bottle and we would introduce the bottle into the baby's mouth here. If the baby is still a little bit sleepy, or if you're struggling to get them to latch, everyone's kind of first reaction is to take this nipple and twist it around, right? Because typically that reminds the baby the nipple's in the mouth, and then they'll start to suck. We don't want to do that. So that can kind of be obnoxious, and it can actually create some oral aversion down the road. So if the baby has the bottle in their mouth and they're latched on and they're not sucking, giving them kind of a gentle head massage can be a good way to accomplish that. If they're real sleepy, you might need to maybe reposition them a little bit and kind of get them woken up. A diaper change is a great way to get a baby to wake up before it's time for them to eat. You do not want to unswaddle a baby that is withdrawing during a feeding. We need them to stay as organized as possible, so the nice tight swaddle is really helpful. So we'll get our baby latched here, and sometimes they get so aggressive and so hungry that they start to attack the bottle and they suck, and they forget that they need to pause to breathe, right? And so if we notice, oh gosh, milk is pouring out of this bottle. If we notice that the baby is sucking and they're not pausing to breathe, oftentimes people want to remove the bottle from the baby's mouth and sit them up, right, and get them to breathe again, which works, but it is not the most effective technique because now we have kind of paused and disorganized the baby. Yes, they're breathing, but now we've got to get them back into position and we've got to get them back and organized. So a more appropriate technique, if the baby is not pausing to breathe, would be to say, okay, this baby has been sucking, suck. We count like 4 to 6 bursts. And then we just simply tilt the bottle down so that the milk runs out of the nipple, but we don't break the seal. So once this happens, usually as the baby's sucking, they realize that nothing's coming out of the bottle and they will pause to breathe. And so then instead of having to get them reorganized and reintroduce the bottle, all we have to do at that point is to simply tilt the bottle back up, and now all of a sudden they've got milk and they can begin to suck again. So you would just continue this pattern back and forth, 4 to 6 suck bursts before we make them kind of pause to breathe. And what you'll notice is that as they settle into that rhythmic feeding pattern, they will start to pause and breathe on their own and have that normal suck, swallow, and breathe pattern. So that's called pacing. We use this with our Eat, Sleep, Console population, and we also use it with premature babies. So it's a technique that can be used with any baby that's struggling with some feeding difficulties. I mentioned earlier, we really want to avoid moving that nipple around in the baby's mouth. You will also might notice some disorganization. So sometimes the baby will kind of root around even though the bottle's in their mouth, or they will struggle to latch and stay latched. Maybe they cry in the middle of their feeding, or they're maybe a little bit gaggy, or they're gulpy. So all of those things are really important to note and let the nurse caring for the infant know that you're seeing those behaviors. Those are all signs of feeding disorganization, and that is part of the disease process of withdrawing, and that can be things that we need to address over time. So just make sure and let them know if you're seeing those struggles. The other thing we want to think about is we usually try to burp our babies at least once during a feeding, but some babies need to be burped more often. And so if you've taken care of newborns, oftentimes what you will see moms do is they'll prop the baby up on their shoulder and they'll, do this number, which can be an appropriate technique for burping. But what happens is that for babies that get overstimulated really easily, we're moving them around a lot. We're going from this position all the way up here, and then we're patting and their head is going like this, which can be a little uncomfortable, right? So oftentimes what you'll see us do is we'll simply take the baby from our side lying position up to a sitting position. And then what you want to do is kind of rock their center of gravity forward a little bit. Take your hands and really support their chin and their cheeks, kind of lean them forward so you're supporting the bulk of their weight right here in your hand. Then you're just going to take your palm and you're just going to rub up on their back and kind of move that air up. You don't have to pat. You can give some gentle pats, not required. Just kind of gently move up on their back. And usually you'll get some burps out pretty quickly. If you're not having any luck, you can also just kind of take and rotate them around. It kind of moves the air around in their belly, and then kind of lean them forward again and rub up on their back. So sometimes if babies are really disorganized, you might find that they need really frequent pauses because they're sucking a lot of air and gulping a lot of air when they're feeding. So that's kind of unique to each baby, but that's a really great technique. And then you can simply go back into your side lying position and we're ready to feed again. Okay, so other techniques for calming. So I mentioned that our Eat, Sleep, Console population tends to be very fussy, which is why they always need somebody with them 100% of the time to address any needs that they might have immediately. Some of the things we have to think about with infants that are withdrawing is the environment that we are caring for them in. So when you think about a baby that's withdrawing, you want to think about what it's like when you go to a spa and it's very zen and the lights are low and it's very calm and it's very soothing. The room that I am in right now would be far too bright to care for an infant that is withdrawing. So we want to make sure that we don't have music going, there's no TV blaring, our phones are on silent, the lights are low, there's not a lot of distracting noise outside. That is going to be the best environment for them and promote rest, right? You can consider lowering the room temperature. We generally don't like to do that in our newborn populations, but with these babies, we don't ever want to unswaddle them because they're hot, and they do tend to run a little bit hot on their body temperature. So if you're finding that the baby is sweating or that their temperatures are a little high, it would be appropriate to take all of their clothes off, go ahead and swaddle them, and decrease that room temperature down to make them a little bit more comfortable. They do like to be held a lot, and so naturally with holding them, that's going to increase their body heat as well as yours. I mentioned earlier that pacifiers will be your best friend, so you don't ever want to be anywhere that a pacifier is more than an arm's reach away. They really, really like to suck on pacifiers a lot. So oftentimes you'll see what look like hunger cues, but you'll know they just ate. Maybe they're not hungry. You want to keep this pacifier close by. It's kind of your lifeline. They'll utilize that a lot. So if they get to a point where they've really escalated, they're crying, we've changed their diaper, we've fed them, we've burped them, we know that there's nothing else bothering them and you just can't figure out what to do to make them happy, there are a couple calming techniques that you could utilize. This population does not do well with patting. So patting, rubbing, anything like this is going to be a little bit obnoxious. They don't tolerate that very well. So you can kind of rock them just real gently. That can sometimes be soothing. One of the other techniques that we will sometimes utilize is if you want to turn the baby kind of away from you. Again, they stay swaddled at all times. You want to make sure that you have your pacifier available, and you can kind of find a wall or something that does not have any distractions. So you wouldn't want to do this in front of a doorway or in front of a TV where there's going to be a lot for them to focus on. You would want to find just a blank wall. And our baby's very upset, so we're going to try to offer the pacifier. They may or may not take it, and you can just kind of sway back and forth, right? And so sometimes this is helpful, can calm them down, kind of just help them check out, not focus on anything. And sometimes this will work. You can get them to take their pacifier, and hopefully they can calm down, and then you can gently kind of transition them into more of a traditional hold. Now, if this doesn't work and they are just absolutely losing their mind, another technique that we will sometimes utilize, and there's not really a name for it, but you'll hear us sometimes call it the triple shushin squat. So with this technique, sometimes babies that are withdrawing have like a cyclic crying pattern, meaning you kind of have to break that cycle of crying before they realize that they're safe and they're contained and they don't have anything that they need to be crying about. So in order to do that, you're gonna, again, make sure the baby's nice and swaddled. You're gonna put the baby up kind of on your shoulder, and you're gonna make sure that you have nice secure grip kind of on the back of their neck, and I usually put some support under their booty. And then you're going to make a shushing noise in their ear, so you're gonna shh. But as you do your shushing noise, you're going to squat. So it looks like this, shh, shh, shh. And when you do the shush and squat, usually it's a little bit startling to them. We're not trying to scare them, but it startles them just enough where they will usually pause their crying and kind of be like, oh, I'm safe and I'm contained and somebody's holding me and I have no reason to be crying, and they'll usually pause. And then they usually start crying again. It takes a few times of doing this before they'll really kind of get into a calmer state. So you can do this 2 to 3 times. And hopefully by the 3rd time after they've paused crying, they realize that they're safe, they're warm, they're contained, and consolable. And so once you kind of get to that point, then you can transition back down and immediately give them that pacifier that they will likely want. And hopefully then you can kind of get them into a calm state. It's very easy to get overwhelmed with this population, especially if you have a baby that is requiring a lot of attention and they just seem to never be soothed by what you're doing. So recognize that it's okay if you just need a 5-minute break and you're like, hey, I've been in here all day and this baby's been screaming and I feel like I'm losing my mind. They can sense that in their caregivers. They can sense when we're frustrated, when we're stressed, when we're upset. And so sometimes it takes us recognizing, like, I just need to take a break and then come right back, and that would be appropriate to ask, if you need just a 5-minute breather to be able to calm yourself to come back in. But also recognize that if we're not able to get this baby to calm down and to be soothed, we do not want them just crying 24/7. So that would be a time that hopefully your nurse is getting involved and making a plan for what the escalation of our next steps would be. So hopefully you found this education a little bit beneficial. Hopefully it makes you a little bit more comfortable caring for this population. Know that you are never alone, and know that you can always ask questions to the nurse who's caring for the baby. They are there for you as a resource. They should be able to kind of walk you through things that have worked or that don't work with each individual baby. And you can always reach out with questions as well.